When it comes to the right time to administer a medication, there are a lot of things we have to think about. We have to think about the action of the medication. And I talked before about chronotherapy. An example of those would be cholesterol meds, where you're going to give the medication at night because that's when the body produces the most cholesterol. Certain medications like anticoagulants and antibiotics have to maintain a certain blood level, so you want to give them regularly. If you are administering meds in a hospital or a nursing facility, there are times that are listed, and you need to make sure you understand the meanings of orders like BID, which is how many times a day? Yes, you're right, twice. TID, 3 times a day. QID, which is 4 times a day, versus 4 times a day around the clock. So it's important to know exactly when you give these meds. And if you are working with a patient in a clinical setting, you want to look at their patient routine. When do they take their medication at home? Are they supposed to take it before breakfast or after breakfast, during a meal, before a meal, after a meal, before they go to bed? Very important to make it clear to the patient when this med should ideally be taken, and find out if there are any situations with the patient that might change how they need to take their medication. The right dose, very, very important, and a lot of considerations when it comes to determining the right dose. How old is the patient? We talked earlier about different considerations for different ages, like the changes in the number of receptors in a child versus an elderly person. Many drug dosages depend on the weight of the patient, and determining a drug dose, especially for a child, is a kind of subjective matter. We don't always have the best way to determine the drug dose. So many times we just look at the person's weight, the child's weight. And a lot of drug dosages are going to be given depending on weight. And in math, of course, we learn some various ways to figure out the weight of a child's dose. Health status. We learned about the importance of liver in metabolism and kidneys and excretion. And if you've got a damaged liver or a decreased kidney function, it's going to change the dosage for a patient. If the patient is vomiting, that's going to change their ability to take their medications. Have they had a recent change in health status? Changes in the status can require changes in dosages. Maybe you have a patient who was who's always taken a particular blood pressure med, and for whatever reason, now their blood pressure is consistently low. Maybe they've started exercising, maybe they've dropped some weight, maybe things have just changed in how their body reacts to that particular medication, and they consistently have hypotension and postural hypotension, and they don't feel well. They might need their dosage decreased. And of course, we know that giving a correct dosage requires the correct equipment. If you want to give a patient insulin, we're not going to give it with a regular IM syringe. They have to have an insulin syringe that measures things in units. We need to make sure of the proper drug form. If somebody has a rectal medication ordered, we don't want to give them an oral medication. If a patient gets half a tablet, we want to make sure that that's a scored tablet to make it easy to cut in half. If a capsule is coated, enteric coated or sustained release, we don't want to break it or crush it. Right route. We have to know exactly how to give the medication. The way we give the medication determines what the effects of the medication will be. We always want to prefer the oral route if the patient is awake and alert and able to take their meds, just because it's easier on everybody. We know that if fast delivery is needed for that medication, IM injection is fast, IV is faster. It's immediately available. So if it's an emergent situation, usually IV is the preferred route. You want to know if a drug is given sub-Q or IM. You don't want to give a pain medication sub-Q. It's usually too much, plus it's not absorbed quickly. If you give an anticoagulant IM, it's going to get in too fast and the patient's going to develop a hematoma because of all those blood vessels. If a drug's inhaled, know if it's getting inhaled through the mouth or the nose. If it's a topical med, is it otic, meaning you give it in the ear? Is it ophthalmic, meaning you give it in the eye? Always has to be labeled. Is it a shampoo that you administer and rinse out or leave on? You have to know how you're giving it. Now, a nurse cannot alter the route prescribed without the order of a healthcare provider. So you go in to give maybe a Phenergan tablet to your patient who's been a little bit nauseous but has had no vomiting. So you go in and all of a sudden the patient is throwing up everything but their shoes. You can't say, I'll be right back, I'm going to give you a Phenergan shot instead, unless the doctor has made an order. You need to go and call the healthcare provider and say, I went to give Phenergan, the patient is vomiting very heavily, can I have another route of administration? Very, very important to document properly. There's an old adage that nurses repeat all the time: if it isn't documented, it wasn't given, and that is so true. If you are sitting in a court of law and you are trying to convince them that, yes, I gave them that med. I gave them that med every single day. I gave it to them just the way it was ordered. If you haven't documented, you don't have a leg to stand on. Nurses should only document what they themselves have given. So if you have seen the patient take the medication with your own eyes, then you can write down that it was given. Otherwise, don't depend on word of mouth. If the patient tells you, yeah, that nurse before you gave me thus and so, you don't believe them unless you see it documented. You want to document medication administration accurately as soon as possible after that medication is administered. Don't document ahead of time anticipating, because sometimes things happen and you end up not being able to give the medication. You're out in the nurse's station and you're like, okay, I'm giving Mr. Jones his medication just the way I have every weekday morning for the past 2 years. So you click, 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 click that Mr. Jones gets all his meds, and then you walk into the room and Mr. Jones has been taken out for breakfast on a day passed by his family. So make sure that you see the medication being taken so that you can write down as soon as possible that it's given. A lot of times you give a med and you think, oh, I'll remember, that I gave this medication, and you have the best of intentions, but you forget and it doesn't get documented. Most important of all, never give meds prepared by another nurse. You're walking down the hall to go to your patient and your, dearest friend on the floor comes flying by with a syringe in his hand and says, my patient in such and such a room is having chest pain. This room needed morphine. Would you go give it? What would you do? You don't want to go give the med. Even though this patient or this nurse is the person you trust most in the world, no. If you haven't prepared it, you don't give it. What do you say? Best practice, you say, why don't you go give the med? I'll go check on your patient and let you know what's going on. Never, ever, notice it's in red, give meds prepared by another nurse.